In cases of an almost complete airflow cessation, we call the event apnea, and in cases of a partial airway cessation, we call the event hypopnea. Both are respiratory events and usually are associated with a drop in oxygen saturation. Usually they last from 10 seconds to 30 seconds. Even though there are some parts during the sleep, we can see their respiratory events for a minute or even longer. In a middle-aged adult, it is normal that he has some pauses of his respiration during sleep, but there is an upper limit. This upper limit is 5 respiratory events, namely apneas or hypopneas, every hour of sleep. And we have an index that is called the apnea and hypopnea index. From 5 events to 15 events, we call this mild sleep apnea. From 15 events to 30 events, it is called moderate sleep apnea. And above 30 events, it is severe sleep apnea. We can say, based on studies that are well performed during the previous years, that 28% of males, middle-aged males, and 9% of middle-aged females will have an abnormal apnea and hypopnea index. Namely, they will have more like 5 respiratory events every hour of sleep. Then 4% of males, adult males, and 2% of females will have an abnormal apnea and hypopnea index and also excessive daytime sleepiness. Sleep apnea is more prevalent in African Americans, especially in young African Americans. It is the way, it's the craniofacial structure of these patients who have made them frequent to have sleep apnea. We actually underestimate the incidence of obstructive sleep apnea. It is probably more. The more obese people we have, the more sleep apnea we're going to have. There are many people underdiagnosed. Snoring is actually, the tip of the iceberg. And it is also not specific because in the 5th and 6th decade of life, almost half of the people snore, at least occasionally. Another thing during the night are the multiple awakenings during the night. Sometimes we have the feeling that we have not breathed enough. Other things are we make grossly movements during sleep. We have to go multiple times in the bathroom. There is nocturnia that is related to obstructive sleep apnea. Or they may tell us, I don't remember my dreams anymore. Or they can tell us we have vivid dreams, we have nightmares. This is a common presentation, not in males, but in females. So the second complaint is tiredness, fatigue. They wake up in the morning and tell us, I have the feeling that I'm not sleeping any. I'm just running a marathon. Yes, and they cannot perform anything, social activities, familiar activities, nothing. They are tired during the whole day. Another symptom that is common are disturbances in the mood. Anxiety, depression, irritability, impaired concentration, everything that is related to a sleep of a very bad quality. There is a genetic predisposition for obstructive sleep apnea, so we have to ask people with obstructive sleep apnea for other persons, especially first-degree relatives who also have obstructive sleep apnea, irrespective if they are thin or obese. Environmental factors are crucial, not exactly to produce sleep apnea, probably to worsen underlying obstructive sleep apnea. Also, risk factors are comorbid disorders like pulmonary disorders, chronic obstructive pulmonary disease, restrictive disorders of the lungs like pulmonary fibrosis, disorders of the heart like congestive heart failure. During obesity, there is a fat deposition in the regions of the neck. So we talk about this collapsible tube. So the more fat we have in our neck, the more possible it is that the tube is going to collapse during sleep. And this is the way the neck circumference plays a crucial role. The other thing is that central type of obesity has a restrictive impairment in our lung volumes, and small lung volumes also predispose to airway collapse during sleep. The other thing is related to the metabolic part of the disease. Many people believe actually that sleep apnea is a part of the metabolic syndrome. And just recently it has been found that there is enough research done in order to have the finding of a strong association between obstructive sleep apnea and type 2 diabetes. Obstructive sleep apnea is very common in patients with stroke, and this is like the chicken and the egg story. So someone who has obstructive sleep apnea may have a stroke, And after stroke, we can have central sleep apneas in cases of a stroke in the areas of the respiratory control. So as you can see, it's not one thing. There are multiple things that play a role. It's the crucial thing that is called obesity, and there are other things around that have always to be taken into account. The gold standard for diagnosis is a sophisticated procedure that is called polysomnography, sleep study. So the patients have to sleep inside a sleep laboratory. That means that they are going to be wired up, and we are going to record many functions of their body while they are sleeping. So we are having an EEG, electroencephalography. We are going to monitor airflow in the mouth. We are going to see muscle activity during sleep. We are going to record snoring. We are going to record respiratory effort, cardiac rhythm, oxygen saturation, capnography. We are going to see about leg movements, and there is going to be also videoscopic recording that is going to show us strange behaviors during the night that may be significant. It is an attendant procedure, so there is a technician who is responsible for the patient, and he is going to stay all the night awake in order to see all this. CPAP devices are effective in almost all cases with obstructive sleep apnea. This device is going to blow air inside the nose and the mouth in order to produce a pneumatic splint to keep the airway open with positive pressure. So there is a mask that is covering the nose or the nose and the mouth in order to deliver positive airway pressure inside the pharynx. In case we need to find something else, we have to send the patient to an ENT to see the nose, the throat, everything. That there can be an obvious reason for obstruction in the upper airway. Surgical treatments may be done in adults with excessive retrognathia, micrognathia, but the results are not always the best. To deal with obesity, and we have to bring patients in a sleep lab in order to have a sleep study.